Polycythemia vera, or PV, is a rare chronic blood cancer that causes your bone marrow to make too many red blood cells, white blood cells, and platelets, which can cause serious problems like blood clots that may result in cardiovascular complications. So joining us today is Dr. Brandy Reeves, Assistant Professor of Medicine, Division of Hematology at the University of North Carolina at Chapel Hill, and also Gary, who is a polycythemia vera patient. Welcome to the show, guys.
Thanks for having us.
Okay, first of all, Dr. Reeves, can you share with us what exactly is polycythemia vera, or PV, and what are the typical symptoms of this?
Yeah, so polycythemia vera, or PV for short, is a chronic blood cancer, again, that leads to the bone marrow making too many mature blood cells. And the too many circulating blood cells leads to thick blood, which can slow down the flow, similar to a car engine with old motor oil. And that can lead to problems, as you mentioned, like blood clots, especially strokes, heart attacks, or blood clots in the legs and the lungs. And there are other symptoms that with PV patients experience, including fatigue, itching, especially with a hot bath or shower, burning or tingling in the fingers and toes, concentration problems, with which patients usually refer to as brain fog, and feeling full after just a few bites of food. And then over time, the abnormal stem cells in the bone marrow can lead to scarring there, which is called myelofibrosis, in addition to changing to a very aggressive blood cancer called acute myeloid leukemia.
Gary, tell us a little bit about yourself, including your diagnosis journey.
I'm an avid hiker. I live on Cape Cod in New England. I do a lot of hiking in the mountains. And I had the symptom of burning in my toes, and I just wrote it off as a part of hiking. Well, those symptoms started to come more fast and furious, and they were more prevalent when I wasn't hiking. So I went to a podiatrist. That didn't help. Eventually, my primary had some blood tests done and found that I had a JAK2 mutation. And I was diagnosed with ET, which is another MPN, or blood cancer, in this particular family of blood cancers. I then went to Boston to find a specialist because I wasn't happy with just monitoring my platelet level. I went to Boston, found an MPN specialist, got more blood tests, had a bone biopsy done, and it was confirmed that I had polycythemia vera.
Dr. Reeves, can you share a little bit more about treatment options for PV?
Absolutely. So in general, the only cure for PV is a stem cell transplant, which carries a lot of risk. And so PV has an overall survival expected at 13 plus years. So that risk is generally not merited for early therapy. So as such, our therapies are really aimed at reducing the risk of blood clots and improving the MPN symptoms, while not making the bone marrow more angry and progressing to myelofibrosis or acute leukemia. So generally, the way we manage this is all patients get a baby aspirin to help reduce the risk of blood clots. And then we try to keep the hematocrit, which is a measure of red blood cells, less than 45%, with therapeutic phlebotomy, as Gary had, or combining medications to reduce the blood cell counts. And the preferred first-line medications for PV who need more than just phlebotomy are a chemotherapy pill called hydroxyurea, or an under-the-skin injection called ropeg interferon alpha, which is also known as Besremi. And the big difference between these two treatments is that while both hydroxyurea and Besremi can reduce the blood cell counts, only Besremi targets the source of polycythemia in the bone marrow. And which treatment option we ultimately recommend, much like Gary's experience, depends on patient factors such as age and other medical problems and patient preference.
Now, Gary, you mentioned that you're happy with your current treatment. What do you want others living with PV to know?
I think just make sure that you're seeing an MPN specialist. Make sure that you find a community. If you can find people that have the same cancer that you do, you can share with them what your symptoms are and talk about treatment plans. You could go on to the MPN Research Foundation website. You go on the Besremi.com website. There's PV Reporter. There's a community out there. There's specialists out there that can help with treatment.
And thank you to both of you for being with us today. And Gary, best of luck with your treatments moving forward.
Thank you for
Thank
having
you.
us.